Here are 7 things you have probably heard about labor that are actually wrong. And some of these myths don't just confuse you, they actually put your baby at risk. I am Dr. Elizabeth Nonubari Obidinu, and I'm a consultant obstetrician and gynecologist. So welcome to the Obstetrician's View. This is where you get clear, trusted, and practical pregnancy advice. If you're pregnant, planning to be, or supporting someone who is pregnant, this video will help you replace fears with facts, because what you don't know about labor can actually affect how safely it goes. So let's break down 7 common myths and what you should know instead. Myth 1: labor always starts with your water breaking. This is not true. In movies, it's always dramatic, a sudden gush, then panic, and this signifies that labor has started. But in real life, most women start labor with contractions first, not water breaking. So water breaking simply means the amniotic sac has ruptured. That's the sac around your baby has ruptured. It can be a gush, it can just be a slow leak. In fact, some women are already in active labor before their water breaks. If you're waiting for that particular sign of water breaking, you may delay getting care. Your water can actually break before you have contraction, but that does not mean that it must always come first. Also know that if your water breaks before contraction, without contraction, you should also let your healthcare provider know. Better still, go to the hospital. So the key point is, don't rely on water breaking alone. Pay attention to contraction and other signs of labor. Myth 2: labor is unbearable for everyone. Now, yes, labor is painful, but it's not the same for every woman. Different people have different levels of pain perception. So it cannot be the same for everybody. Pain depends on your body, your body's position, your mindset, and your support system. Some women cope well with pain, others need pain relief, and that is completely okay. You have options. You have breathing techniques, you have movements, you have water baths, epidural, and other medical supports that can be given. Also, fear makes pain feel worse. So when you understand what is happening, you cope better. So the key points are, labor pain is real, but you are not powerless. Myth 3: you must rush to the hospital as soon as contraction starts. Not necessarily. Early labor contractions can be mild, irregular, and far apart. And this phase can last for hours. So if you go too early, you may be sent back home or admitted too soon, which can lead to unnecessary interventions. A helpful guide is what is called the 5-1-1 rule, where you time the contractions. It's coming every 5 minutes or every 10 minutes for at least 1 hour. It tells you that labor has started. This does not mean that you must stay in the house until you get this. It's just a guide. And if you cannot bear the pain until you get that, it's fine. Please go to the hospital. You can also go earlier if your water breaks, if you notice bleeding, or you notice your baby's movement reduce or is absent, or something doesn't feel right. Key points are, stay calm in early labor. Not every contraction means go now. Myth 4: if you scream, you're doing labor right. Not exactly. Labor is intense, yes, but panic and tension can actually increase pain perception and slow labor, and of course, make you exhausted. So what helps more is controlled breathing, relaxation, and support. Your body works better when you are calm and focus. You don't need to be silent. I'm not saying be silent, but how you respond matters. So the key points are, calm breathing helps your body work better in labor. Myth 5: you must lie down during labor. This is not true. Labor is active, and staying mobile can actually help to reduce pain, help labor progress better, and improve the descent of your baby into the birth canal. You can walk, sit upright, do some squats if you can tolerate it, or use a betting ball. Basically changing position. Gravity helps your body. Of course, in some cases you may need monitoring, but if you can move, it often helps, okay? Especially if your water has not broken. So the key point is movement supports labor. Myth 6, a cesarean section means you have failed. That is completely untrue, completely false. A cesarean section is sometimes the safest option for both mother and baby. It may be needed if the baby is in distress, if labor is too long, if there are placenta problems, or the baby's position is not ideal for vaginal delivery. The goal is not just vaginal delivery. The goal is a healthy mother and a healthy baby. So that is what success in labor actually is, always is. So the key points are: safe delivery equals to successful delivery, not necessarily the route of delivery. Myth 7, labor is the same for every pregnancy. It is not true. So untrue. Every labor is different. Even for the same woman, one labor may be longer, another may be shorter, faster, another completely different. It depends on your body, it depends on your baby, it depends on your health, it depends on the support you get. So don't compare your experiences to someone else's experience or even your previous experience. Key point is stay informed, but stay flexible. Okay? Stay informed, stay flexible. Don't expect it to always be the same for every pregnancy, for every labor process, for every time you go into labor. So let's do a quick recap. Labor doesn't always start with water breaking. Labor is not always unbearable for everyone. Some people can bear it, and really, some do bear it. You must not rush to the hospital at the first sign of labor pain. Number 4, screaming is not the way to do labor right. 5, you must not lie down in labor. Number 6, cesarean section is not failure in labor. Cesarean section might be the best option for a woman who is in labor or haven't even gone into labor. Success in labor is healthy mother, healthy baby, and not whether you had a vaginal delivery or not. Number 7, labor is not the same for every pregnancy, not even for the same woman in different times of labor. Labor is not the same. For different people, it's different. For the same woman, different labor experiences. Labor is not always the same. So labor is not something to fear. It's something to understand. When you replace myths with facts, you make better decisions, you stay calmer, and you improve your labor experience. If this helped you, save this video, share it with a pregnant friend, and follow the Obstetrician's View for trusted pregnancy advice. And before you go, tell me in the comments, which of these myths have you heard before? I'll see you in the next video.